Welcome to this video, which is designed to explain what Pifu is and how admin manage these through the Cerner system. Pifu stands for Patient-Initiated Follow-up. This tool ensures patient safety by limiting the potential risk to patients who are sitting on waiting lists for follow-up, sometimes deteriorating without this information being known to the treating team. Patient-initiated follow-up is therefore a key part of both our attempts to reduce waiting lists, ensuring patients are being seen at the right time. There are two types of patient-initiated follow-up work lists to manage. The first is Pifu discharge. This is where the clinician and patient believe that the condition is self-limiting and should resolve. In this situation, the clinician would not arrange further follow-up at the hospital, but complete a new order entry on Cerner for Pifu discharge, with a clear discharge date submitted on the request. The clinician would complete a letter to the patient and GP to a referrer advising of the Pifu shared decision, which advises the patient to contact between an agreed timeframe, and if no contact, the patient would be discharged. If a patient calls to initiate an appointment from a Pifu discharge request, admin can book this appointment from the workflow list. In this video, you will be shown how to find the Pifu work lists, filter these and manage when required. Using Revenue Cycle on Cerner, select the workflow perspective on the left of the screen. Depending on your role, you may see one assigned specialty or multiple, if working in a centralized team. Double-click the required specialty using the Requests option. You will now see a number of work lists that allow you to view follow-ups and Pifu requests. On the right of the screen, this will show the amount of patients on the work list. Double-click the required work list to view the patient's details. Here you will see a number of columns including the patient's MRN number, name, date requested, and the begin and end date that was specified by the clinician. These lists can be filtered by responsible clinician, begin or end date and location. To do this, click the search box at the top of the screen and select the filter or multiple filters required. I will select Responsible Clinician for this demo. This allows you to search for a particular consultant's requests instead of seeing all of the consultants within that specialty. The position of the columns can be moved and also removed if not required. To do this, click the three dots in the top right-hand corner. Click View Layout, then click Edit. To rearrange the columns, use the arrows on the right of the screen. If a column isn't needed, untick this from the list. Click OK. To ensure these settings are saved, select the three dots again and click Save. There are two ways to view the order information. First, you can click the small arrow at the bottom of the screen. This allows you to view the request before having to access the patient's record. Alternatively, double-click the patient on the list to access the patient's record. If the patient does not initiate an appointment and comes to the end of the agreed Pifu discharge date, admin must manage the Pifu discharge worklist on Cerner, validate the patient, ensuring no further episodes have been made under the encounter, and discharge. This will then remove the patient from the Pifu discharge workflow list. If the patient hasn't contacted the service in the agreed timeframe, the patient must be discharged. Before this can happen, a check must be done to ensure another appointment hasn't been booked against this encounter. This is visible at the bottom of the screen by checking the Futures Appointment tab. Here we can see the appointment is in a checked-out state and will not affect us being able to discharge the patient. If an active appointment has been booked against the encounter, you may need to dig deeper to find out why. We can now discharge the patient. Before this can be done, the Pifu request must be cancelled, as you cannot discharge an encounter with open activity. To do this, click the 3 dots at the top of the request. Select Cancel Request. Add a comment if required and click OK. To discharge, select the 3 blue squares at the top of the screen and select Attended Referrals. This will then appear in the bottom right-hand corner. Use the scroll bar to confirm this is the encounter that needs to be discharged. Right-click this and select Complete. Add the correct date and select the relevant RTT code for the patient. Click OK. The patient has now been discharged from the service. The second type of Pifu, known as Pifu moved, is used where a patient will require an intervention, such as face-to-face follow-up, blood test monitoring, or diagnostic screening, at set periods. But in between the set events, the patient may contact you if they have an exacerbation in their symptoms. In this situation, the patient would be placed on the Pifu pathway, at an interval to be determined by the clinician. However, at the end of this pathway, they would be added to a work list for action, rather than discharged. An example of this may be where a patient needs annual telephone follow-up, but they need to contact the service before this if they have a concern. The Pifu pathway is scheduled and the patient invited to contact at any point within the year if they have a flare-up of symptoms. However, if they have not contacted at the end of the year, then they will appear on the holding list, ready for a telephone follow-up to be made as planned. Again, this is a safe method of following patients up, as they are invited to contact us directly if their situation changes. However, they can still receive their annual review appointment if their condition is stable. Admin must manage this list, alongside the booking workflow lists, to ensure patients are booked in date and priority order. If a patient contacts the service whilst the patient is on the Pifu moved list, or if the scheduled timeframe has come to an end, an admin member of staff would arrange a face-to-face or telephone appointment on Cerner. If a standard face-to-face appointment is required, please follow these steps. Double-click the Pifu moved work list. Double-click on the patient that requires the appointment. Use the 3 dots in the top right and click Complete. The appointment type and location should already be completed, but the location can be changed if required. To specify which consultant the appointment needs to be booked with, select this from the Preferred Resource drop-down and click First Available. The date range will pre-populate to the date on the original request. For this demo, I will need to amend this. Other filters are available on screen if required. If any changes have been made, click the Suggest button. At the bottom of the screen, you will see any available slots matching the criteria specified. Click on the slot to highlight and click Select. Confirm the details are correct on screen and click Confirm. You will now see the appointment has been booked and is visible in the Future Appointments section. The Pifu moved request has also been actioned and will no longer show on the list. If a telephone appointment is required, the Pifu request will need to be cancelled first and an appointment booked separately, as the appointment type needs to be changed. To do this, double-click on the patient required from the Pifu moved work list. Click the 3 dots in the top left and select Cancel Request. Add any comments required, then click OK. Select the Summary tab at the top of the screen, then click the 3 blue boxes to add the Attended Referrals section. This will appear in the bottom right and can be made bigger if needed. right-click on the correct encounter and select Schedule Appointment. Follow the same steps as previous to book the appointment, but ensure the appointment type is set to the telephone option required for that specialty. Depending on the specialty, when the Pifu request comes to an end, the patient may need adding to a work list for a member of the admin team to arrange. This needs to be done via Power Chart so the request can be seen by admin and the clinicians. Follow the previous steps to cancel the Pifu moved request on Revenue Cycle. With the patient still in the blue banner, click Task at the top left of the screen and choose Power Chart. Use the Encounter selection box to select the correct encounter for the request. This will always be the active outpatient encounter for your specialty. Using the blue menu on the left of the screen, then click the Request Care Plans option. Click Add. Start to type the specialty. For this example, I will use Derm. Ensure the correct appointment type is selected. This could be a standard follow-up or a telephone appointment. The Ordering Clinician box will appear. Click OK. All the yellow mandatory fields must be completed before being able to move on. Once completed, click Sign. The order has now been added to the relevant work list to be scheduled by the admin staff. This is visible in the Request Care Plans section. Thank you for watching.